Alright, hello again everybody, this is Patrick.
And I'm Dustin.
And we're going to do a quick little assessment of the abdomen and the chest. So to start off with, I'm just going to ask you a few questions, get a little health history from you. Just ask you some routine questions.
Absolutely.
Nothing to be alarmed about. Alright, let's see what we got here. Have you been coughing at all? You got a cough?
I do have a cough.
Oh, really? How
Yes.
often?
It has been usually nighttime.
At nighttime, okay.
Nighttime, yeah. I think I have bronchitis, maybe.
Oh, you think so?
I'm guessing.
Yeah. Has it come on gradually, or did it happen all of a sudden?
I was sick, and then after I started feeling better, it kicked in.
When did this happen?
About a week ago.
About a week ago, okay.
Yeah.
Have you had any chest pain when you cough?
Not very much. Just a lot of phlegm.
A lot of phlegm, but
Yeah.
no pain of no sensation of pain or tightness in your chest when you cough.
No.
What about when you take a deep breath? Do you have any chest pains then?
No, it just makes me want to cough.
Okay,
Yeah,
all right. Well, that's fair enough. Coughing is good. You bringing up any sputum?
I don't know what sputum is, Patrick.
Well, are you bringing anything up when you cough?
Yes, sometimes.
What color is it?
Brownish.
Brownish, really. Were you on any antibiotics or anything?
I was not. I should be.
Well, no, I mean, if you're writing it out, you're okay.
I got a prescription.
Oh, okay. Is there any unusual odor to the mucus that you're
I do not smell it.
Yeah, okay. Well, I mean, you notice a taste or something, like an odd taste in your mouth or smell. Okay. All right. Anything make it better or worse, like weather or activity or anything like that?
When I'm not laying in bed, it goes away. So when I'm active and drinking and hot beverages.
Okay.
Yep.
All right. Fair enough. And what about your ears? Do you have any ear pain when you cough?
No.
Okay. All right. Good. Have you been short of breath at all? Any trouble catching your breath?
Sometimes.
Oh, really? When does that happen?
Also at night.
Also at night. Oh, so it comes along with the coughing when you're laying down? Oh,
Yep.
Okay. Is this a recent thing, or has that been a normal thing for you over a while? Or is it just
for a week? I think I'm sick.
Oh, okay. So when you're not having that illness, that's not a symptom that you have usually?
Never, no.
Okay. All right, and you already answered the question on this when you're laying down. Have you ever woken up coughing, or is it only when you're laying down to go to sleep?
I wake up and cough. Yeah.
Okay, you've been waking up and cough. Do you have any night sweats or anything like that when you wake up?
No fevers. Yeah.
Oh, okay. All right, good. So it sounds like you've had a recent infection and you're getting over it.
Yep.
So that's good. You smoke any cigarettes?
Do not.
No cigarettes. Okay, good for you. What about any occupational exposure? Do you work somewhere where you're exposed to respiratory irritants or
Nope.
dust particles, paint, anything like that?
No. Nope.
Oh, okay, good. You been tested for tuberculosis lately?
I have not.
No, okay. Ever have a chest X-ray?
I have.
Oh yeah.
Yep.
What did you have the chest X-ray for?
I have a plate in my clavicle.
Oh, okay.
My clavicle, so I've got a lot of body.
Oh, okay.
Also, at one point, it was assumed that I may have an ulcer. So.
Oh, okay. So people have been beaming radioactive waves at you then.
Yep.
All right, good.
Yep. I'm the Hulk.
You get vaccinated routinely?
No, it's been a while. It's probably been.
Oh, okay. So you got the usual stuff when you were younger, probably? Yeah. Okay. Now, when you sleep at night, how many pillows do you use?
2, but I sleep funny, so.
Okay.
Yeah.
If you were to sleep with 1 or no pillows, would that affect your breathing negatively?
No.
No? Okay. It's just for comfort, muscle, skeletal comfort.
Yeah.
Not for your breathing. Okay.
I often wake up Indian style. This isn't a joke.
Yeah.
And hunched over a pillow. I don't remember.
Really?
I don't remember getting into that position, but I sleep like that.
Well, that's really interesting because that's a position that helps your lungs expand more. Usually people have trouble breathing.
Is that really?
That position.
Yeah, I wake up. I always wake up like that.
You're just sort of waking up like that.
Every morning I wake up like that.
Wow, that's really interesting.
Yeah.
Huh.
I got some pictures.
You ever get a sleep study done or anything like that?
No, I thought about it for money. I see it on Craigslist.
Oh, okay. Wait, for money? Like people pay you to do a sleep study?
Yeah, a month.
Usually you pay them to do a sleep study.
No, they pay you. They say we'll watch you for a month.
Oh, interesting.
I see it on Craigslist at least. Maybe it's fake.
Well, yeah, you never know on Craigslist.
They're selling your organs.
Has anybody ever pointed out that you're turning blue in the face? Or
No.
you ever get no blue skin color in your lips or your cheeks or anything like that?
Nope.
Okay, haven't turned blue at all. Good.
I have incredible circulation.
Okay. You know anything about your family's health history? Like any diseases or disorders your family?
Just high blood pressure, polycystic kidney disease.
Oh yeah. Okay. What about heart failure? Anything?
A lot of heart problems.
So some heart You know, a particular type of heart problem?
I don't.
Okay, just heart problems in general.
Yeah, I know it always leads to heart attacks. So.
Oh, okay. Maybe some coronary artery disease or something like that.
That could be it.
Okay. Well, I'll be interested to have a listen. Have you had any muscle cramps lately or anything like that?
No, actually the only ones I get are from my toes to my knees, up here. I get a cramp through my whole leg.
When does that happen?
I don't know. I've had it ever since I was 5. I can remember.
Does it just come on all of a sudden, or is it?
Yeah, when it comes on, it'll last sometimes just a little bit or for days, and I kind of have to it's weird. I actually punch my leg up here to try to dull the pain.
You ever try heat and cold or anything like that? Like
I used to put my feet in hot water, but you really can't get rid of it.
Interesting.
I don't eat a lot of potassium, I think.
Huh.
I don't know if that matters.
Yeah, I'm not sure. I'm not a dietitian.
I know it cramps you.
All right. Any changes on the skin, on your hands, arms, legs, anything like that? You getting any like strange skin areas or changes in your skin?
No, I look pretty good.
Yeah, skin looks pretty good. All right, good.
Good tan for the winter.
Yeah. Any like swollen glands or nodes or anything like that? I mean, nothing swollen or funny? Okay.
No, I'm good.
How's your appetite been lately?
Incredible.
You've had a good appetite? You
Always.
Hungry at meal times?
No, I eat at night a lot.
Oh, you eat that late at night? Okay. But not during the day?
I think it's when I'm bored.
Okay.
I eat a little bit during the day.
You do a little bit of grazing?
Yep.
How's your swallowing? Any problem swallowing? Been coughing when you eat at all? Anything like that?
No, I can swallow fine, yeah.
Okay, good.
Yep.
Is there any particular kind of foods you can't tolerate? Anything that makes you sick when you eat it?
No, I don't know.
Okay.
Nothing.
You can eat pretty much anything that sounds good to you?
Yep.
Okay, alright, good. When was your last bowel movement?
I don't know. Probably hours ago.
Okay, so today. You probably went today. Okay, no problems there. You're not getting bound up or anything?
Nope.
Alright, good. Any history of stomach diseases? Oh, you said the ulcer. You said you had a history of having an ulcer.
Yeah.
Or they thought you had an ulcer?
I didn't have it. I don't believe I had one.
And you didn't have it,
no.
okay. You ever any like heartburn or indigestion or anything?
Yeah, every once in a while.
Every once in a while, but it's not like a routine.
It's not a common occurrence, no.
Okay. The last thing for the review of systems is I just want to get a feel of everything that you've eaten in the last 24 hours.
Okay.
And this is a little memory exercise. So let's start with dinner time yesterday. What did you have for dinner yesterday?
I had...
Well, I'm going to write this down.
Okay.
All right.
I had a bowl of cereal, followed by a steak.
Okay.
And another bowl of cereal.
Okay.
That was my dinner.
And what did you eat after dinner and before you went to bed? Did you have a snack or
potato chips.
Potato chips, okay. And then this morning, what did you have for breakfast?
I did not have breakfast.
Okay, you skipped breakfast.
Yeah.
When was your first meal today?
The first meal was at lunchtime. I had a bag of edamame.
Lunchtime, you had a bag of edamame.
Yeah.
And that was all you had?
And then dinner.
Was the edamame cooked or raw?
It was cooked.
It was cooked, yeah. With salted or something like that?
Not much salt, light salt.
Okay. What about after lunch and before dinner today? What did you
have? After lunch, I had a bag of Doritos, little bag, 2 ounces.
Okay.
And then a turkey sandwich for dinner.
Okay, and then a turkey sandwich, okay. All right. Well, that's it for the silly questions.
All right.
You feel like you're satiated after you eat? You feel like you're getting enough food?
Yeah, I feel pretty good.
Okay, you're not like eating until you... It doesn't sound like...
I've been slowing down because sometimes I overeat and get sick.
Oh, okay. So when you eat too much, you get like nauseous. Any other nausea besides those times?
No.
Okay. What about dizziness or anything like that?
So, that's weird. Actually, you asked that. Past couple months, I started getting dizzy. I don't know why. It's actually, I feel my head tingle when I get dizzy.
Really? Any particular time of the day?
No, it was just random.
It just happens randomly?
Yeah, it's happened a few times since.
Huh. That's interesting. Yeah. All right. Well, just because moving around makes the contents of your stomach move around, I want to start off listening to your stomach. Because everything that we're going to do after that is going to move it around.
Yep.
So if you want to get started, you can just take your shirt off.
I would love to.
Okay, great. And then lay down, and then we'll get started.
On my stomach or on my back?
On your back, please.
Okay.
All right. The supine position.
All right.
I'm going to wash my hands a little bit.
I learned how to take my shirt off from watching movies. Girls do it real quick like that.
Oh, like that?
One move.
Yeah. That's pretty slick.
That's pretty good.
Oh, yeah, I can see the scar now from where you had the hardware.
Yeah.
Yeah, that's interesting. All right, now I'm going to pop a couple of gloves on. And so the first thing to do is just to look at it, and everything looks symmetrical. Don't see anything bulging out. You never had a hernia or anything like that? Okay. And your hair pattern is pretty even.
Do I look good?
Well, you look healthy. That's good. I hope you stay that way.
Thank you.
Yeah. So now that I've inspected the abdomen, I'm going to take a listen, and all I'm listening for is just to make sure your bowels are moving.
Okay.
Normal things, I should just hear some like a stomach rumbling sound, but it's really close because I'm amplifying it.
You got it.
All right, I'll just turn up the volume on this a little bit. All right. It's not too cold, is it?
No, not at all.
All right, good.
I felt that one.
The technical term for the sound that I'm listening for is a really funny word. It's borborygmus.
Yeah?
I like that word. It looks even more ridiculous when you write it down. Alright, move this hand a little bit.
Is that Latin, Patrick? It sounds Latin.
Alright, I can hear everything moving.
Yep.
Now I'm just going to tap on your belly. I'm going to percuss it a little bit and listen for the tone. Yeah, it's a pretty dull sound. I don't hear any like resonance or timpani like if there's gas or like fluid in there. All right. Feel any pain when I push right here?
No.
How about right here?
No.
Feel anything right here?
Mm.
And how about right here?
Good.
Okay, good. All right. Now I want you to take a deep breath all the way in.
Right.
Okay. Now let it out. All right. Right here is where it changed. Let me just get the pen. Just gonna make a little mark right there. All right, now just take a deep breath. Now blow it all the way out. And right about there. Alrighty. So that's it for that.
So what are you marking, Patrick?
Where the borders of your liver.
Okay.
All right. Now I want you to take a deep breath and blow it all the way out. Feel for where your heart beats the strongest. Try not to breathe in for a second. Okay? Now just breathe normally. I'm just going to feel for unusual pulsations and things like that. Okay, good. All right, now I'm going to try to feel the bottom edge of your liver.
All right, you got it.
Okay, now take a deep breath in. Now breathe all the way out. Now breathe in. Okay.
That felt weird.
Yeah, okay. Yeah, I can feel a little bit. All right, feel the kidneys, the cecum. I shouldn't be able to feel your spleen because you only feel that if it's enlarged. I don't feel that at all. That's good. A bit deeper in there. Okay, good. All right, why don't you go ahead and sit up? All right. So I'm gonna take a look at your hands. Look at your fingernails here. Your nails are a little bluish.
Yeah.
Have you noticed that?
No.
This is the first time you've noticed your nails are bluish?
I don't know. I thought they always look like that.
Yeah, okay.
Is that bad?
Well, it's, good and bad are relative terms. And I also noticed that your skin from this joint up is a little bit of a darker color.
Yep.
Okay.
You're making me self-conscious.
All right, I'm just going to feel your pulse for a second. All right, let me try the other one. All right, those are about equal. Let me see your elbow. All right, and the other one. All right, raise this arm a little bit. All right, and now the other one. All right, good. Now let's take a look at your feet here.
Ooh. Are they purple too?
Yeah, there is the same kind of discoloration. But when I push on the red spot and it turns white, the red comes back really quick. That's good. That means your blood vessels are working really good.
I was told hairy feet means you have good blood circulation.
I don't know if that's true or not.
Is that true, Patrick?
I don't know. I've never heard that before. Okay, so could you face away from me?
Yeah. All right.
Yep. All right. All right, I'd like you to just breathe out all the way. All right, take a deep breath in, and breathe out all the way again. All right, take a deep breath in, and breathe out all the way. All right, breathe normally for a second. All right, now take a deep breath in. All right, breathe out all the way, and take a deep breath in. All right, breathe normally for a second. All right. Now breathe out all the way. Okay, breathe normally for a second. Now take a deep breath in. Okay, breathe normally. Alrighty. Now I'm just going to measure that real quick with my handy. I'm measuring with a bandage. It's got a little ruler on it. It's the only it's the only ruler I have consistently on me. And it's about 4 centimeters. All right, good. I'm just going to listen to your lungs real quick. So I'm going to tell you to take a deep breath and do a couple of other things.
You got it.
All right. All right, take a deep breath and just let it out whenever. And again. And again. And again.
Excuse me.
That's all right. All right, I want you to say 99.
99.
And 99 again.
99.
Now say EA.
EA.
All right, try that again.
EA.
All right, good. And EA again.
EA.
All right, now just whisper something. It could be anything.
Oh, Patrick. You make me feel comfortable.
All right, keep whispering.
Hello, Patrick. How are you doing today?
Okay, good. All right. Now I'm just going to feel how your chest expands when you breathe. Just take a deep breath in. All right, good. And again. All right, good. Now say 99.
99.
And 99.
99.
And 99.
99.
Okay, great. Now turn around and face me if you would.
All right.
This is fun so far, isn't it? Yeah, good.
I realized when I said I take my shirt off like a girl, I didn't mean in inappropriate movies.
Oh, right. You meant in
like if they were wearing a disguise.
In like normal movies, right? Okay.
I don't want to make this inappropriate.
Okay, no, I want to keep this very professional. Yeah.
Yes.
Okay. Say 99 again.
99.
And 99.
99.
And again.
99.
And again.
99.
And again.
99.
Okay. Take a deep breath. Okay, great. Everything's nice and symmetrical.
Good.
I'm going to listen to your heart real quick. Now, I may be listening for a while. That doesn't mean necessarily that anything's wrong. I'm just supposed to listen to it for a while. I really get a feel for it. Okay, so don't be concerned if I'm listening for a long time.
Yep.
down to Herb's point right here.